Hi, I'm Mike Gibson coming to you live from SCAI 2018, and I'm here with Rahul Sharma. Rahul, they teach you a lot in a fellowship program, but what they don't teach you is how to transition into that first job after fellowship. So how has your entry been into the marketplace, and what kind of advice can you give to fellows out there?
Yeah, thanks for having me. You know, I totally agree. I think we get so much focus and time and energy spent on training us to be great operators, great doctors, taking care of our patients and paying unique attention to their needs. But we don't really get much training or education on what to do when we take our first job. And I think that certainly there's no one-size-fits-all strategy. Many of my colleagues are in private practice, some in academics, some hospital-employed positions. So there is no one equation that fits all. But I think there are some common do's and don'ts and things that I've learned in my first 9 or 10 months on the job since I finished my structural heart fellowship.
So number one.
So number one, I would say you have to earn the trust of your colleagues. If you truly are the only doctor in your group, then maybe it's a little bit of a different situation, but many of us are working with senior, more experienced interventionalists who are Jedis in the cath lab. They know what they're doing, they've been around the block, they've seen it thousands of times, they have a much bigger denominator than we do. And as great as our training has been, it is incumbent on us that when we take that job, we integrate them into the tough cases to ensure the best outcome and build that trust, that working relationship that I think is so crucial, so that when it does come time for us to do those complex cases on our own at 2 o'clock in the morning, they know that their junior partner is going to be very deliberate and is a trustworthy operator.
They know what can eat you and what you can eat.
Exactly.
Yeah, big
so
difference.
that I think first and foremost, building that relationship of trust, which does not happen overnight.
Sure.
And it is a very important process, and I think sets you up for everything else that you want to do professionally and personally in your career.
Number two.
Number two, I would say stay in your lane. So, you know, some of us are coming out of advanced interventional fellowships. We're trained in coronary, CHIP, CTO, peripheral, structural heart, coronary imaging, and other fields that are just springing up within interventional. You cannot take your first job and live under the misconception that you're going to do it all.
Right.
This may sound obvious to some, but I think when you look at the real world practice, there are people that are going out into their jobs and thinking they're going to do coronary, they're going to do structural, they're going to do peripheral. And you have to pick one or two things that you really are invested in and do those things well. First of all, you know, you can't play well in the sandbox if you're doing everything that your partners are doing. There has to be some degree of differentiation or specialization within your group. So I really do think that it's important to, it's great if you're trained in everything, but it's important to pick one or two things and focus on those and do them well.
Train but focus. How about number three?
Number three would be find something that your group is currently not doing, that your institution is not doing, that you feel passionate about, that motivates you, and dive into that. I think if you are another hire for your group or for your institution and you just replicate and continue to do what's already being done, potentially at a larger volume, you're really not making full use of the role of hiring you. So if your group is not very much into clinical trials or clinical research, jump into that.
Yes.
If they're not publishing and writing a lot and you enjoy doing that, jump into that. If there's opportunities to partner with educational resources to teach fellows or residents in your institution in a unique way, do that. Show your partners that you can be value added, that you're going to do more than just another rotational atherectomy and stent to the mid-LAD, but you're going to take things to a different level, bring your institution, bring your group in a different direction that they haven't had the time or focus to maybe go in, or enhance something that they're already doing. So I think be value added to your institution. Don't just replicate what's already being done.
You are wise beyond your years, Rahul. Thanks for that great advice to all the young people out there, and thanks for joining us here live from SCAI 2018.
Thanks a lot.